TMS, or transcranial magnetic stimulation, is a way of electromagnetically stimulating selected parts of the brain in which the neurons are either depolarized or hyperpolarized. Research has shown that that process, done repetitively over a period of some weeks, can lead to alleviation of depression and can be useful for many other conditions as well.
TMS, or transcranial magnetic stimulation, has been around. It was FDA approved in 2008, and at the present time, most, if not all, insurances offer coverage for TMS. We at the TMS Center of Colorado work very hard to try to work with patients and get coverage for their care that they receive at our facility.
So the classic person who would be appropriate is an adult with a treatment-resistant or non-treatment resistant depression who just wants to try this modality.
The patients that have the most success generally are patients that have treatment-resistant major depressive disorder. And those are usually the patients that seek us out because we're FDA approved for the treatment of depression. It's kind of hard to say which patients are going to respond to treatment and which ones aren't off the gate. But generally, we see folks with kind of that treatment-resistant depression where they've tried several medications and lots of therapy and several things prior to coming to us for TMS.
In terms of psychiatric conditions, deep TMS is very, very effective for bipolar disorder, can be very effective for anxiety, can be very helpful for sleep. There is a submission to the FDA to have it cleared for obsessive compulsive disease, which is a very hard disease to treat in a general approach. In terms of neurological conditions, Parkinson's disease has been targeted, epilepsy has been targeted, migraine has been targeted, post-stroke rehabilitation has been targeted, some of those with very good results.
We've treated folks for sleep disorders, and we found that that has been very effective for some people. We've also treated folks that have bipolar disorder, and we've had really great success working with that. The difference between deep TMS and standard TMS is, one, the way that the machine looks and how the treatment is administered. So our machine looks like a helmet that's placed on the head. Standard TMS is kind of a coil that's placed on the side of the head. But the biggest difference is that our machine stimulates deeper into the brain and also hits a wider area of the brain. So with standard TMS, there's a fairly small beam that they're using in order to hit the target. And for us, we have a much bigger beam. So we have kind of a smaller margin of error, and we're also just hitting a greater area of the brain, which could potentially give us better success in treating depression.
Deep TMS spreads the TMS stimulations in a much larger area, and we're able to hit an area of the brain with each treatment about the size of a tennis ball. So we are much less likely to miss an anatomical target that we are targeting.
The beauty of the brain sway in some ways is that it's got this huge field, and so you really don't have to be a neuroanatomist to get the field in the right spot, and it's deeper, more powerful, of course.
Most of the patients that we have treated have had either a terrific response or a good response, which is really what they care about the most. Obviously, you're coming in here with a severe problem and you want to get it better. In terms of the treatment experience, they're usually very well tolerated. The treatments can take from as little as, depending on the protocol, 10 to 15 minutes to as long as 20 to 25 minutes. But then the patient is able to get up, drive home immediately or drive to work immediately and continue their day. So it's pretty undisruptive.
The initial treatment's maybe an hour because we're getting some of these basic variables sorted out. Thereafter, it's like 30 to 45 minutes per treatment. We do treatments 5 days a week. And we also do them on Saturdays for people who want them.
Often it takes about 2 weeks. That's a typical time window, that at the end of 2 weeks or about 10 to 12 treatments, a patient will notice that they're feeling better for a few minutes or a few hours. It doesn't sustain, but seeing that shows us that TMS is actually working, and it's just a matter of continuing with the treatment for as long as necessary, usually 4 to 8 weeks, to get the desired effect.
Every patient is different in terms of how quickly they start to see results. Early on, we look for what we call our glimmers, and these are just moments where the patient feels a little bit better. Or maybe they notice that they're starting to sing to music in the car, or they're laughing at a joke. Something comes up even just in one moment that feels a little bit different than what they've been experiencing with their depression. So we're looking for those at about week 2, 3, and 4. We call those glimmers, and again, those aren't big changes, but they're just little moments of feeling better. And then usually we start to see that those moments get bigger and bigger throughout treatment. And generally we're seeing that patients are having, the most robust response week 4 or 5.
And it's about a 6-week course of treatment. So people will typically not feel any different at all for the first 2 weeks, maybe 3. And it's usually around week 3 that people will start to have a benefit. So not always, sometimes it comes later, but I tell people not to expect anything for the first 3 weeks.
There is a new TMS protocol called Theta Burst. This can be done with deep TMS, can be done with standard TMS. And this has quite a lot of advantages for patients. It's a much shorter protocol. Often it lasts 3.5 minutes.
It's a shorter protocol, and it seems to be more tolerable for patients as well. It also allows us to target multiple areas of the brain in one session. So instead of just targeting one area and having that take 30 minutes, we can do multiple Theta Burst treatments over a few different areas of the brain in the same amount of time.
Theta Burst is considerably easier for the patient to tolerate. When we do standard treatment, we get what's called the motor threshold, which varies for each patient. And we need to treat at a dose of about 110 to 120% of that motor threshold. However, Theta Burst stimulations are done at 90% of the motor threshold and last shorter. So uniformly, we get feedback from the patients that it's much, much easier to tolerate. Also, the minimal seizure risk that exists with standard TMS is virtually eliminated with Theta Burst stimulation. There's only been one reported case in the literature from the last many years of Theta Burst causing seizures. So there are a lot of advantages to it, and it's certainly, if I was a patient, I would certainly consider a center that is comfortable with Theta Burst and has used it extensively, because I think it can lead to a shorter, simpler, easier treatment experience and a better outcome.
In my experience administering the Theta Burst treatments, we've had a really positive response in terms of what patients report. So for us, it's great because it takes a treatment that would normally take about 30 minutes and it only takes 3 or 4 minutes. And so that's really nice for the patient because they can come in and be in and out a lot quicker. It also allows us to do a standard treatment but use Theta Burst kind of as an adjunct to the treatment to supplement what we're doing. So we can do a standard treatment and then we can do a Theta Burst on a different area of the brain to just kind of increase our chances of the patient responding. When patients initially come to us, usually because they've tried so many other treatment options that haven't worked for them, they're feeling pretty down and their depression has kind of taken over. So when they come in, we try to provide a really supportive environment for them. We try to offer them hope, let them know that it's going to be a few weeks until they actually see change.
The level of potential for efficacy is so huge and pretty profound in the field of mental health. There's not many treatments you can point to and say they have over 2/3% of chance of helping someone get their life back, and this treatment does that.
TMS is one of the cleanest treatments in all of medicines in terms of risks and side effects. It's extremely minimal compared to medication, ECT, or any other treatment.
Yeah, the common story that I hear from patients is typically that, they've tried basically everything that they can try prior to TMS. So a lot of the stories that I hear when folks call in to inquire about TMS are that they've been on several medications. Sometimes they've been in therapy and on medications and seeing a psychiatrist for 20 plus years, and either nothing has helped or things start to work and then they wear off, or they have really negative side effects to the medications. And so I'm often, hearing that folks don't know what to do next and have come across TMS as, maybe one thing that is different than medications that can help them.
It's an honor to be able to work with folks who are in such pain, but are able to communicate that as best they can and are here, fighting for their lives. And it's really an honor to be a part of, and we do a lot of checking in and getting to know the patients really well. By the end of the course of treatment, we're pretty close, I would say.